Hey, happy Wednesday, ladies. Hope you are having a good week so far. I'm happy to join you again for this week's Wellness Wednesday. Um, I am excited to talk about this topic because it's something that really has, gosh, so much to do with the success of my patients. And anyway, I want to get into that in just a second, but I do want to, as everybody's kind of getting on who was going to get on, I want to give my disclaimer that I need to say every time I do a live event on this forum or this platform. So here we go. Anything that I say tonight should be taken as health information only and not specific health advice. Don't stop taking or change the way you're taking any of the medications that you have been prescribed. If you feel like you should change, please get with your prescribing practitioner and they can help you make those appropriate adjustments. And attending this Wellness Wednesday does not establish a doctor-patient relationship. Okay, so we are going to get into the topic that I've been reminded multiple times this week, and then I got to thinking about several examples. So I'm going to talk about some of these as well as we get to toward the end. But we're going to talk about drainage pathways. Drainage pathways. So our bodies have a waste management system. This helps us to detox. So let's kind of talk about what that means. As our cells work, they create waste. Okay, so they take in fuel just like a motor or a car burns gasoline in the engine and it creates exhaust. That is the waste from the car. Our bodies, as the cells function and burn glucose and fuel, create exhaust or waste, and our cells have to get rid of it. Furthermore, we take in substances all the time that, whether in our food or in the air we breathe or the water or liquids we drink, we take in certain toxins, and our body also has to get rid of these. And some of us are, function very well at getting rid of these toxins. I have spoken before about biotoxin susceptibility, genetic biotoxin susceptibility, and about 35% of us have these genes where they make us unable to clear these toxins out of our bodies. And so that's not good. Toxins, there are consequences to these, and they do things to our cells that damage them and create inflammation, cause inflammation, and that's why we have symptoms and disease. So what happens if this system of ours, this waste management system, gets clogged or is stagnant? It's like, it's like a septic backup. That's never a good thing. And so, well, we have to figure out if that's an issue and work to solve it. But let's talk about what this means. So our bodies in this waste management system, there are pathways of this drainage system. We're going to call it now drainage pathways. And the analogy that I want to use, it's like the streams and tributaries that flow into, more larger streams, and then rivers, and then tributaries, and then or tributaries, and then into rivers from there, and then larger bodies of water. And it's like this downhill flow. right? And so within the body, these pathways are the lymph and lymphatics, liver and gallbladder, kidneys, colon, okay? And I'm going to get back to those, but let's first talk about why it would be so important to open these drainage pathways in our bodies to properly support detox. Because once again, we don't want to have a septic backup, right? All right, so some of the detox symptoms that you need to be aware of would include headaches, fatigue, insomnia, increased symptoms that you're already having. And this would be temporary. It's like a temporary exacerbation of these symptoms. But opening these drainage pathways also protects the body from this toxin flood. All right, I have addressed this a little bit before when talking about, and I know we don't like the term weight loss, but when we talk about weight loss, we're talking about releasing fat, and toxins are stored in the fat. When the body doesn't know what to do with something, it puts it into the fat for storage, and then the fat takes on water to better, for lack of a better term, dilute those toxins. And so our fat cells swell. And so a lot of times, those of us who are overweight or even obese, unfortunately, are full of toxins. And then the more toxins we take on, and the more the fat cells, swell, then those fat cells produce more toxins themselves, inflammatory cytokines and toxins that, because toxins are biological, they are from living organisms. And so it's important that we understand this mechanism, because this is one of the reasons why we feel the way we do and look the way we do. And we've got to look for these toxins. Anyway, that's a topic for another time. But as we were talking about opening these drainage pathways so that we have a better time getting rid of these toxins, being more comfortable getting rid of these toxins. We hear stories all the time. You may have done this, or your friends may have done. What happens when you have just done maybe you've ordered like a cleanse or a detox kit online, and you've just decided, I'm toxic, I got to get these toxins out, and then you end up doing it and you feel awful. All right, you get these symptoms, right? You get these headaches, or you feel more fatigued, or you don't sleep well. Well, it's because you weren't prepared properly for that detox. And so you didn't open your drainage pathways properly. That's why it's so important. To me, it's really important to help you with that. If you realize that, yes, there are toxins you have, and we get there by testing. We understand better what toxins you're dealing with by doing the right tests, the right genetic tests for this, for the biotoxin susceptibility. Well, this way we know what we're dealing with. So let's talk about these different organs. I'm going to share the screen with you. Let me get this pulled up. All right. Let's look at this. Okay, so another way to look at this is like, you have this drainage funnel. And so, and this is another way to think about it. Each and every cell, like I said, has to drain these toxins, these waste products, exhaust, aerobic, so like free radicals, aerobic waste, and so this includes our brain cells and our deepest cells of every organ. They must get the waste and toxins out into the organs themselves, so that these organs and tissues can drain into the lymphatic system. There we go. That's a little better. Hopefully you can see that funnel. Okay, into the lymphatic system. And then, and I should also say glymphatics, which is the brain's lymphatic system, or the nervous system's lymphatic system. And let's see if I can fix something. Oops, no, didn't mean to do that. Now we're going to go back to this. So it's really important that we understand, like I said, if this is not open, we're not going to drain properly. We're going to have difficulty with symptoms. Other detox symptoms would include rashes, because look, you're going to drain through your skin. Kidneys are going to take more of a hit if your liver and bile ducts aren't working properly. Lungs, you're going to have perhaps problems with breathing. Maybe this flares your asthma if you have asthma, or if you have interstitial lung disease, this is going to create problems there. But if you are able to keep these open, then you will drain these and eliminate these toxins through the colon. Okay, so I want you to kind of keep this image in your head as we talk about the rest of the topic tonight. So the lymph and glymphatics. Think about this as like these little streams and that are flowing out from down the mountains, and they're eventually going to drain into maybe larger creeks. This might be the like the venous system, that the lymphatics drain into the veins that are going throughout all the organs, all right? And then those those veins drain into, those veins drain into the larger veins of the body, and ultimately collect in what's called the vena cava. They end up in the vena cava, going into, well, it goes through the heart, and then it ends up in the liver. All right. Ultimately, all of these streams go downhill into the liver. The lymphatics, first of all, end up in what's called the lymphatic duct, and then that drains into the larger vena cava, into then that must drain into the liver. Okay, there's your anatomy lesson. I'm not going to go further into that. I'm just trying to illustrate the point that small multiple streams end up in larger, fewer streams into the main drainage streams or rivers that end up in your liver. Okay, then your liver and bile, through the bile system, takes care of these toxins and this waste. And the gallbladder is a really important part of that. And so when it gets the right signals, the gallbladder squirts more bile into the bile duct, and that pulls all those toxins from the liver into the colon. that bile duct drains into the colon. All right. And the colon is the final holding place for waste and toxins. Hang on just a moment. So that way you can get rid of these toxins the right way, just like I was showing you in that funnel. All right, the kidneys, what role do they play? Now they control the hydration of the colon. And so again, through the right hormone signals, they pull water out of the colon, or they leave enough water in the colon for things to move through properly. Now you can imagine why it's so important to empty your colon regularly. Now, I have talked to so many who think that it's normal to go and have a bowel movement every other day, a couple times a week. Yeah, no. If you didn't know this, normal, regular bowel habits consist of 2 to 3 bowel movements a day without help, without laxatives, without Miralax, without, those substances that are helping. Now, natural things like fiber from our food, yes, that's really important. That helps us go regularly. So that's an important constituent. But should you have to take extra fiber? Not really. But if you have to, it's a good idea, because you really want to keep things moving. I talked to someone today who it's not unusual for them to go to have a bowel movement every 7 to 9 days. Like, holy moly, no wonder they're not feeling well at all. No wonder they have issues, because those toxins will now they're being held in the colon, and that allows enough time, because even if they sit for a day, the toxins get reabsorbed through the colon, the cells of the colon wall, back into the body. And it's sitting there also causes more and more inflammation. And we know what that causes. So it's never a good thing to be backed up in the colon. Once again, if that happens, you then have to, your body's trying to get rid of these toxins. It's going to they're going to go through other pathways. Like I said, the lungs, the kidneys, the skin. All right. So it's important that part of opening the drainage pathways involves getting your colon to move better, move more regularly. And that requires eating properly, not eating the foods that are toxic and are going to disrupt the bacteria in the gut, so in the colon and in the intestines. It just makes sense, right? And so, okay, let's talk a little bit about the kidneys and how we can, help them along. So the kidneys need proper hydration, and I recommend half your body weight in ounces, if you can. And then moderate protein. You shouldn't have too much protein. You need to be careful about how much protein, because too much protein consumption will stress the kidneys too much, and that can cause kidney disease. So usually about 0.6 grams of protein per pound of body weight at the most. Now, if you're not very active, that needs to drop. And so, I I teach my patients, on an individualized basis, how much protein they need to consume, given several factors. And it's just, it's something I can't really share with you now because it really is customized to the individual patient. So just know that that's ultra important. And so, yes, the kidneys, if they're functioning properly, they're able to control the colon's hydration, and that controls how often you go. Yeah, every time we eat a meal, that sends a signal to the gut and the colon to move things along. And it should give you an urge to go. I know. I know it's uncomfortable talking about that a little bit, but this is an extremely important part of getting well and healing. You have to get rid of toxins to heal, to reduce inflammation, and to allow to free up resources that the body needs, not to deal with the toxins, but to actually help your cells be productive and produce energy, right? That you need. You need this energy. So I want to talk about a couple of patient cases, just brief explanations with some of my patients that to illustrate this point. Joanne was dealing with chronic kidney disease as one of her issues, and low energy and persistent low thyroid symptoms for certainly. And as we got digging into what her root causes were, we discovered that mold was a big one. And so as we went through, helped her go through her her customized plan of care, we got to where we prepared her, we helped her open her detox pathways. She, for one, was not having daily bowel movements at first. We had to help her out with that. And so giving her the right help, certainly helping her with the dietary changes and giving her the right supplements to help with her bowel movements. She started to have more than one a day, and all right. Now it was time to better help her to detox. We were also watching kidney function and helped her change her eating habits in a way that facilitated better kidney function, or that helped with better kidney function, and supplements as well that facilitated better kidney function. And so now I'm happy to report that as she's been able to clear mold toxins with the testing that we do, that's part of the blueprint for repairing your thyroid health and so forth. Well, retesting and recustomizing care is essential. So as we've retested, we found that she is pulling these toxins out, and mold toxins. And lo and behold, her kidneys are improving. Her GFR is improving. It's increasing. It's increasing. And the creatinine is decreasing like it should. That's what we want to see. We want to see an increase in GFR and a decrease in creatinine. So yeah, totally awesome. She told me last time I met with her that this is just a new lifestyle for her, what she's learned in her customized care program. And she is feeling so much better. The energy increases. It's like night and day for her. And she is doing very well. So had to open her detox pathways, facilitate detox in a fairly comfortable way. And she's reaping the benefits. Awesome. So, okay, Robin admittedly really struggled at first with her with making the changes that she needed to make. And so I'm sharing her story because I think it illustrates where a lot of you might be. It's hard to make these changes. And so as we progressed through her care program and she was having some difficulty making these changes, we started helping her with parasite detox. Now, yes, just like I explained, we helped her to open her drainage pathways. So she was going better, more consistently. And as we treated her for parasites, she's and opened these pathways, she started passing all kinds of worms. When she started noticing this, not hard to notice, and I know it's disgusting. You guys, I know it's not anything any of us want to see or experience. I get that, but it made her pretty motivated to now make the changes because she was seeing results. She was like, okay, Dr. Ed, I'm on it. And she started being much more consistent with her diet and just making the changes that she needed to make, and started to to lose some fat, release some fat, and because she was quite obese, and this improved her brain function. She started noticing less issues with brain fog and difficulty concentrating. So, and this helped her better take care of her husband, who was going through some pretty serious health issues of his own. So the benefits, just realizing the benefits of opening drainage pathways is very, very, it's encouraging. Edna, also dealing with diabetes and parasites and obesity, cataracts. As we helped her to, and she was working with one of my coaches, my practitioners, did very, very well. She opened her drainage pathways with treatment of her parasites, started again noticing daily passage of parasites. She went in to see her ophthalmologist, who was just doing a checkup on her cataracts in preparation for cataract surgery. And it was like after, probably 3 to 4 months of being able to detox, treat the parasites and pass tons and tons of parasites. He looked at her and said, "You don't need surgery anymore. You don't have cataracts." And obviously this was so cool for her. She was just elated, couldn't wait to tell us. And so, I mean, gosh, I mean, as her and her diabetes was improving, and she was decreasing some of the medication she was taking. I don't know. I mean, these kind of things speak for themselves. And so opening your drainage pathways, understanding what that is, again, lymphatics, glymphatics, liver and gallbladder function, kidneys, and colon. Okay. These have to be open. These have to be working properly for you to be able to get the toxins out, especially with the right supplements that if you are genetically unable to get these toxins out, this is of utmost importance. This is the key to healing. Honestly, this is the key to reducing inflammation and therefore improving cellular energy and cellular repair. So yeah, this is the key, guys. I think I'm going to leave it there. I had to do this. I noticed the same thing happening with me. I healed personally when I was able to do this, open my drainage pathways. You know, I'm not going to get into the gory details, but I had to treat some of these same things, including parasites. So it works, and this is what needs to happen. So, all right. You're welcome to post any questions in the chat. I can answer them offline, but I am going to leave it there for tonight. And oh, looks like someone, I probably could answer a question. So let's see. Okay. All right. The question is, does blood type indicate who can consume protein easier? For me, the jury's kind of still out on this. According to the blood typing diet, if you've ever read that, it might convince you that, yes, it matters what blood type you are to how much protein you should consume, or what and it's probably there may be something to it, but I have found that even when we really don't pay attention to blood type, we get the results that you'd expect, the good results you'd expect from doing, like I said, from basically sticking to this customization. When we help people customize this to their situations, I found that in practice, it doesn't matter a whole lot what blood type you are. So, I mean, I know there's authors out there that you know, really claim that is of utmost importance, but I haven't really found that to be true in my clinical practice. So, okay, very good. I hope you guys have a great evening. Remember that you still have the power to heal, and I look forward to our next interaction. All right, have a great night, everyone. Take care, ladies.